Osteoarthritis can cause stiff and painful joints, affecting your ability to work or even walk. But what is osteoarthritis, and what's the best way you can manage it? My name's Joss Barratt, I'm an osteopath, and in this video I'll be breaking down my 3 tips to best treat osteoarthritis. So before we do that, I want to break down the process. So day to day, throughout our lives, our bodies are exposed to low levels of strain, and as we get older, normal age-related changes can start to occur. Typically this affects the larger weight-bearing joints such as the knees, the hips and the lower back, but other smaller joints such as those in the wrist and the neck can also be affected. This can cause joints to become painful and swollen, resulting in poor movement and making it difficult to perform your day-to-day tasks. It's often referred to as degenerative changes, but this doesn't mean there's nothing you can do. Have hope. Before using these tips, don't self-diagnose. Google knows a lot, but it doesn't know everything. Make sure you've got the diagnosis from a healthcare professional. Your osteopath or GP can help with this. Now here are my 3 tips. Tip 1. Exercise. Exercise is a great way of managing osteoarthritis. If your symptoms aren't too severe, low impact exercise is the best place to start. This can be something like speed walking, cycling or swimming. Just enough to get your heart rate up is a start. If your symptoms are more severe, swimming or aqua aerobics is a great option. This provides a weightless environment so you don't get that weight-bearing force going through the joints. Any form of movement stimulates synovial fluid production. This acts as a lubricant within the joint. It helps the 2 bone surfaces move over each other without causing friction. Gradual and consistent movement also helps strengthen the surrounding muscles. If you have problems with joint swelling following exercise, an ice pack wrapped in a tea towel applied for about 15 minutes can really help you manage this. If you struggle with motivation, get help. Find a friend, find a trainer. A bit of friendly competition usually helps me, or make a social aspect out of it. Meet for a walk around the park instead of a coffee at the cafe. Better yet, get a takeaway coffee and go for a walk around the park. In the words of Jordan Peterson, compare yourself to who you were yesterday and not to who somebody else is today. Consistent exercise, whatever the level, is a great asset to improving your overall health as well as managing your osteoarthritis. Moving on to tip 2, osteopathic medicine. Osteopathic medicine can be used to treat osteoarthritic pain and can be used to detect, prevent and manage injuries you accumulate through your exercise. This can keep you on track. Aside from this, your osteopath can help guide you with your progression, regression and expansion of exercises, depending on your level and improvement. Improving the range and quality of movement in the joints affected can make exercising a lot easier. Osteopathy is effective for all areas and joints of the body affected by this condition, but particularly effective with hips and knees. Tip 3. Weight loss. This can help reduce the strain on the joints. This is a difficult goal to achieve, and I know a lot of people really struggle with this, particularly as when you do the exercise, the progress might not be reflected in the numbers on the scale. As you exercise, you'll build up lean muscle while burning fat. This is where pictures documenting your body can be better for motivation. It'll show you how your body's changed, even if your weight doesn't reflect that change. Using any of these methods, especially in combination, can delay or even avoid the need for surgery or joint replacement. If you've tried this in combination with osteopathy and you're still struggling, you should discuss your other options with your GP. Thanks for watching. If you've enjoyed this video, please like and subscribe. If you don't know what osteopathy is, I made a video about it. The link's in the description. If you've got any questions about osteopathy or this video, please leave a comment below.